Well, I am delighted to welcome back Lyndsey from Canada. I forget where. I think you're in the kind of bottom left-hand corner, Lindsey, aren't you?
Yes, I'm on the west coast of Canada in the province of British Columbia, or otherwise known as the wet coast this time of year. It's very rainy.
So how far are you from Washington State?
I'm only a short drive from Washington State, so maybe just a few hundred kilometers.
Right, okay. And how far is that from Seattle, just to help my geography a bit?
About a 3-hour drive from Seattle.
Okay, yeah. That's good, yeah. So we know that professionally you're a pharmacist and you've got this channel that we've been following. But we want to talk to you basically on this talk as a Canadian. Maybe if we start with your personal experience over the past few months, how has daily life been in British Columbia where you are, and what's your kind of general impression and feel for what's happened over the past few months?
Yeah, so I think that a lot changed when we went back to school. So the school year here started back early September, and there was a lot of anxiety about that because schools had been closed during the pandemic prior to that for the majority of the time. And so there was a lot of anxiety over schools. People were very concerned about, rightly concerned about the virus spreading in schools. They did not reduce class sizes, and that was a big concern. And masks were only made mandatory for grades 4 and up, which is about age 10 and up. So there was a lot of anxiety over that. And then once we got in a couple weeks and we realized that actually schools were not a large place of transmission, but at that time community transmission was also quite low. And so we know that what happens in schools is a reflection of what is happening in the community. So as the fall has gone on, our cases have gone up. We're, even late September, we started to see a rise in our curve, and that's happening across Canada. And so the feeling is that, it's getting more and more difficult. So right now in the region that I'm in, we are not in a lockdown, but we have a lot of restrictions. The restrictions have been more targeted, and the pandemic has played out very regionally in my province, as it has in most places throughout the world. So more restrictions in places that have more cases. But right now we are not to socialize with anyone outside of our household. We are only to go out when it is essential. Schools have remained open though, because transmission in schools has remained quite low. And we've actually had not even sure if we've had any official outbreaks in schools. So they're doing their best to keep schools open because they know if they close them, then that affects parents who can't work and so on. So I would say that anxiety is fairly high at this point, especially because in the last week, that's when we were given the orders to not socialize with anyone outside of your household. Grocery stores were starting to look like they did when the pandemic first started, some empty shelves, that kind of thing. And you can just sense that anxiety is a bit high at the moment.
General sort of tension building up in the community,
Yeah.
What is mask wearing compliance like? So when you go to your local supermarket, everyone wearing masks or half wearing masks?
Yeah, they are now. So a couple of weeks ago, our provincial health officer mandated masks in all public places. And she was a bit hesitant to do that, I think partly because she wasn't seeing transmission from places like grocery stores or other public spaces. And also because of the enforcement. Once you mandate something, you need to have a way of enforcing it. Now it's mandated. So now when you go out, everyone is wearing a mask.
So it's a social expectation now. It would be unsociable not to wear a mask now.
Yeah, and it was pretty good before that. I would say, maybe 60-70% of people in my region were wearing a mask. So I mean, it was pretty good, but now it's just going to be across the board. Everyone is wearing a mask, knows how to wear a mask, keeps a mask in their car or wherever it is. So that's what's happened here.
And that the hygiene in stores and public places is quite good, is it? Hand sanitizers and things like that.
Yeah, most places do sanitize the carts. Some still do not. There is one grocery store in our area that actually uses a UV light, some kind of technology.
Okay.
So it's they're doing what they can. It's hit and miss though. Some places I don't really feel as comfortable shopping in, because you can tell that it's not as consistent.
And are people kind of respecting the social distancing thing? That's kind of, has that become normalized now as well?
It has. It's harder in places where it's a bit more crowded, like in a grocery store. I was giving flu shots at a pharmacy, and pharmacies are not always the largest locations, and so you can tell that it's a little bit tricky. Sometimes people don't follow the arrows, but everyone is trying, and everyone, for the most part, is doing their best. So that's all we can ask people. But yeah.
I mean, there has really been quite a remarkable shift in public attitude over the past few months, that people do realise this, and what interests me is the rapidity at which this has become a new social norm. I'm sure some sociologists are doing a PhD in this, because it's changed quite quickly. Now, one of the problems I find in the UK is people still aren't appreciating the importance of fresh air and ventilation. A lot of stores seem quite stuffy. I went to a pharmacist recently, and there wasn't a window open. Actually, I was actually a bit taken aback. What's the culture like in Canada for that?
Yeah, I think there's a lot more that we could be doing as far as ventilation goes. Actually, some good news I saw yesterday is that the Toronto School Board has upgraded some of their ventilation systems. They've installed some HEPA filters, and they've let parents know. I mean, it can get very cold in Toronto, sometimes down to minus 20. So it's very cold. But they sent a notice letting parents know you need to dress your kids warm. We're going to keep the windows open as much as possible. That's something that should have maybe been communicated a couple of months ago. That's something I think I agree with you. It's quite basic.
But the message is getting through. That's brilliant.
It's getting through, and I know that I dress my son warmer for school these days because they are keeping the windows open. So it's something. Now, when we talk about commercial places like grocery stores and pharmacies, no, the doors are generally closed. There's not as much air circulation. I was giving vaccines in a very small room with very little ventilation. So I think that we have some work to do on that front, and there's some missed opportunities for sure.
Yeah, it's the one that's still sort of lacking. What is the public understanding of the importance of nutrition and vitamin D like in Canada?
The public understanding, I think, has been a little bit I think that the whole pandemic has kind of been the main health issue, and it has caused other issues like vitamin D deficiency to kind of fall by the wayside. They
haven't sort of linked the two concepts.
No, they haven't. And I've done my best to try to figure out why. And I think that part of it is that the public, they have had such a challenge with knowing how to communicate, how to have good public health messaging over basic pandemic concepts, such as social distancing, mask wearing, that kind of thing, that I don't think they have the capacity right now to think about trying to communicate anything else, which is really unfortunate, because vitamin D is a very simple way to help protect yourself, and it helps with bone health, but it also helps, as you've talked about, with immune function. So it's something. It's also, I think, a missed opportunity. It's something that I'm definitely talking to people about and taking myself. So especially because we are in a very dark season now.
So what is the temperature where you are? You're in the south of British Columbia, aren't you?
Yeah, and I'm in
what temperature is it?
This is one of the mildest climates in Canada that I live in. So we've got, I think it's about 10 degrees Celsius here right now. The coldest, coldest it will get will be maybe minus 5, minus 10 in a really cold year.
So you're quite oceanic there with the Pacific coast, and So what about other parts of Canada? How cold does it get?
Yeah, other parts of Canada can get down to minus 40 in different areas.
Can you survive in minus 40?
Well, I don't. That's why I don't live there. But
we're talking centigrade here.
But what happens is people go indoors, right? And so that's what's happening is where I am, it's fairly mild, and I don't want to be outside. So in other places where they've already experienced snowstorms and these lower temperatures, everyone's heading indoors now.
Now, what about the northern provinces of Canada? What's going on there? If we take Nunavut, for example, have I pronounced that correctly?
Nunavut, yes.
Nunavut, right? Okay,
yes.
Yeah. I mean, the temperature there presumably is pretty cold now.
Yes. And I don't have exact temperatures, but it's Arctic there. It is very cold. They actually get very little sunlight this time of year. And so the territories, so the Yukon, the Northwest Territory, and Nunavut, they have been a very interesting story during this pandemic because they have been able to protect themselves from this virus for the most part. And if you look at the territory of Nunavut, they've actually had 0 cases until around mid-October. And now they are experiencing a spike in cases. I think they're around maybe 140 or 150 cases. And last week, I mean, there's only 38,000 people living there. Small population, fairly isolated, cold, right? So they have actually instituted a lockdown as of last week. I think they're about a week into their lockdown, and they still don't know where this COVID came from. They assume it was from travel, right?
Presumably most people live in a few relatively small settlements.
And this is the challenge, is people do live in small settlements, and they live in multi-generational households often that are quite crowded. And that, as you know, is more of a risk factor for spreading the virus. So it's concerning what's going on up there.
What ethnicity are most of the people up there, Lindsey?
A large part of the people up there are Inuit. And I'm not sure what the percentage is, but that's a large portion of our Indigenous community up there. And it's interesting. I was reading the other day that they have a shortage of PPE up there. It's not easy to acquire a mask, so they're not mandating masks because not everyone has access to one, and it could cause them to not go out to buy food and that kind of thing. So it's complicated.
You think 36,000 people, you could drop off 36,000 masks with one air delivery, couldn't you? I mean, it seems.
I was really shocked to hear that because, even in my place of work, masks are, I wouldn't say they're abundant, but this is not an issue. And to hear that they don't want to mandate masks at this point because some areas they have, but other areas they've said, no, we're not going to do it because people are actually having a hard time acquiring masks.
It's really simple. Well, first of all, we could teach people to make masks, of course, as you've done extensively.
Yes.
But you think it wouldn't be beyond the wit of the Canadian government to send up a Hercules with 360,000 masks. That's 10 masks for every person. That would be half a plane load or less. It would be surprising they haven't been able to address that, really.
Yeah, every week we get updates from provincial governments about the PPE that's being shipped in, and so I don't understand why this is not something that Nunavut seems to be getting.
So traditionally, the Inuit diet would be high in fish, high in seal, tremendous amounts of omega-3, tremendous amounts of A, B, E, and K, all the fat-soluble vitamins. But has the traditional diet changed now? Do they eat hamburgers up there now?
Yeah, they do. And that's part of the problem with vitamin D deficiency up there, is that a lot of the people have started eating more westernized foods, more processed foods. They actually ate a lot of caribou, which is like a very large deer-like animal. And so they're not eating, their diet has changed significantly. And so because of this, they're not getting the proper nutrition that they need.
And Inuit are actually quite dark-skinned, aren't they? They're darker than you or me, for example.
Yes, they're definitely darker than we are.
And that kind of makes sense, because there wouldn't be the selection pressure on skin color, because the diet was already very high in vitamin D. So but now they've changed on to what some people might call a junk diet. It's a bit of a problem, and I do know they have a lot of diabetes and obesity and other such problems up there. So there's a real cultural change problem, isn't it? Are you allowed to travel out through other provinces in Canada, Lindsey? Can you go off to the west coast or the east coast rather, if you'd like to?
Yeah, so in some provinces in Canada, so where I'm living, I mean, they've asked you now not to travel. So
Yeah.
there's new mandate not to travel other than for, necessary reasons or essential services. But something interesting that happened, at the beginning of the pandemic is the formation of the Atlantic bubble. And I don't think that this has been talked about very much.
Do tell us.
Yeah, so the Atlantic bubble, the maritime provinces, so the far east coast of Canada, has been a huge success story. And I don't think many people are talking about it because in a pandemic, when things are quiet, it doesn't necessarily make the news. So I wanted to.
So the Maritimes that went anywhere on the east coast, basically, is that?
Yeah, so the Atlantic bubble was composed of Nova Scotia, New Brunswick, Prince Edward Island, Newfoundland, and Labrador. And what they did is they acted very early at the beginning of the pandemic. They closed their schools and they started limiting travel. So if you were, they actually shut down travel. No one could go from other places in Canada. You were not allowed to actually travel there for some time. And then once they got the pandemic or their cases under control, they instituted a very low tolerance for any cases. It's interesting there also because they did not have the pushback as to, when we're talking about people who are protesting about masks, lockdowns, that kind of thing. It was observed that none of that really happened in these provinces. And because of that, they were able to form this little bubble where you could travel. Those residents who lived in those provinces could travel around in between those provinces. And, it helped with trade and that kind of thing. Yeah. But they were able to maintain their cases very, very low. And so, yes, did the economy suffer? Of course. Was it a perfect solution? No. But I think it's just a very good example of, and they are having increased cases now, and they are shutting things down again. As across Canada, we are seeing, we're well into the second wave. But it's a great example of how you can, if you take this seriously, and if you have a very low tolerance for, you don't play with this virus, and they haven't. And I think that they really need to be commended on how they've handled this. And even though they're in their second wave, I'm much more optimistic about the maritime provinces right now than I am about other areas in Canada, because they have demonstrated that they have a low tolerance for this virus and they take it very seriously. And it's not really been, as much of a political issue as it has been in other places in Canada.
I think Australia is such a good example of that, isn't it? Yes. The way that you couldn't travel between states in Australia. And yes. I haven't checked for a few days, but I don't think there's been any community transmission in Australia for some time now. It's really impressive. And a lot of that is the restrictions on travel and quarantine, supervised quarantine of travellers.
It's very difficult, but it's effective. And then you can,
Well, the Australians did it, apart from that hiccup in Victoria, but, they paid for that with a long lockdown. But it just shows it can be done in a westernised style country.
Yes.
Just need to have the organisation to do that.
If you commit to it and if you do your homework to test, trace, isolate, it can be done. And it's unfortunate that it's not being done in most of Canada. I think it's a missed opportunity. Much will be said in when we look over this in history as to how we could have handled this better.
Indeed. Now I was a bit disappointed to hear you mention the word political there.
Yeah.
Is this? I mean, is the situation when you say political, like in the States, where you have one political grouping in favour of more lockdowns and more restrictions, another political grouping almost in denial, wanting to carry on, live life as normal? Is it like that, or is it more politics with a small p?
I think that every province in Canada might have a different story to that question, to answer that question. There's an article I just want to share a little bit with you from the Hill Times. So this is an article written by a couple of professors out of the University of Alberta. And, one quote that I can say here is that, let me just find it here. Canada's public health system is failing yet again. Our government struggled to respond effectively to the 2003 SARS outbreak and 2009 influenza pandemic, and they still have not controlled the staggering epidemic of fatal street drug overdoses. We have an epidemic of opioid overdose here in Canada. It's very tragic. And now far less wealthy jurisdictions are outperforming our response to COVID-19. Our system is floundering because of two missing ingredients: public health independence and public trust. And what is happening in many cases across Canada is that, yes, we have politicians who are voted in and they have a certain mandate, and obviously they want to be reelected. And then we have provincial health officers who should be independent, should be able to act independently. And that is, we are seeing that there is, that is not happening in every province.
So the health officials are being leaned on by the political.
Yeah, and that's compromising our response to the pandemic, and it's also compromising people's buy-in to follow these protocols.
Yeah.
And yeah.
So, you know, in Taiwan, the politicians didn't do any of the news conferences. It was entirely medical healthcare professionals that led the entire thing. Mm-hmm. And they eradicated the virus in weeks and have had no cases for, I don't think they've had a case in community transmission in Taiwan since about March.
Yes, and
lesson to learn.
Yes, and Taiwan has also, you know, I have friends whose parents traveled to Taiwan. They've traveled back and forth a couple times during the pandemic. There's so much support for people to isolate. So they send them a little care package, you know, and they've really got things well organized. Whereas it's not the case in most places in Canada right now. And we really don't have any excuse. You know, we're a wealthy country. We have, you know, people who are very well educated. I think a lot of the, you know, part of the problem is that politicians have maybe they have not put enough confidence in public health officials. Public health officials, you know, these doctors that are at the front of our pandemic response, they do take into account, it's not just about health as in infectious disease health. They do take into account the economic repercussions of what they're implementing, they take into effect the mental health, the socioeconomic issues. And so we really need to stop fighting and stop making this, it's either political or it's health. You know, we are all a community, and it's all important. And you know, it's been really divisive and unfortunate to see, especially over the last couple of months here in Canada, because it's confusing for the public. They don't know who to trust.
So we want to talk to you about vaccines when we're talking to you with your pharmacist hat on, but at the moment we're talking to you as a Canadian citizen. So how do you see things going in Canada? I mean, you've got a long, hard winter in Canada. Mm-hmm. The direction, actually, at the moment, to be fair, is up, isn't it? Now, to be fair, the cases in Canada per capita are nothing like the UK yet. Nothing like the United States. Mm-hmm. But the thing that concerns me is the trajectory is up. How are you reading the next few months, Lindsey?
Yeah, I'm quite concerned. I was just listening to our Chief Medical Health Officer, Teresa Tam, and she was saying that the way that our cases are going up, we're about 5,000 cases a day right now. By mid-December, we're projected, if we do not, put in different measures to mitigate the virus, we're predicted to get into maybe even 10,000 cases a day. And the hospital capacity here in Canada is very, very low compared to other countries. So we do not have a lot of capacity, and it's not just a matter of adding beds. It's a matter of healthcare workers and, just capacity in the system. So I'm quite concerned.
I mean, 10,000 cases a day. I mean, the population of Canada is what, roughly?
Around 35 million.
Yeah, so per capita, we're talking about a lot of demand on healthcare provision there, aren't we?
Yes, and we're already seeing that. There are some hospitals, the province of Alberta, some hospitals that are already, they're signaling out warning signs. Listen, we are very close to capacity. We are canceling elective surgeries. All of this was preventable. This did not have to happen. And so, and we know that hospitalizations and deaths are a lagging indicator. So we know that with time, we are going to see more hospitalizations and unfortunately more deaths.
And what I think I hear you saying is it could get to the point where there could be unnecessary deaths because of lack of healthcare provision. That is the worry, isn't it?
It's possible. I hope I'm wrong about that, but I think that it's definitely possible.
It is kind of where the trajectories are going. I mean, that is my concern there. When is Thanksgiving in Canada? Is it different from the US?
Yeah, we had Thanksgiving actually in October, and
right.
yeah, we did see a bit of our curve was already going up before then, but we did see, a bit of a spike because of that. I am concerned about Christmas because I think some people think that these restrictions are so we can have a good Christmas, and it's not. These restrictions are so we can keep our hospitals with some kind of capacity, and Christmas is going to be different this year, and I'm concerned. One of our premiers in Alberta the other day, he is closing down schools as of I think Monday and keeping them closed until January 11th. And I watched his press conference, and he said, well, because people will see their families, and then we'll keep the schools closed because of that, just in case there's extra cases. And I thought, well, that's not very good public health communication. Like, well, we'll let you guys have your parties, and then
it's kind of giving up, isn't it?
It's really unfortunate. It's one Christmas, it can be different, and it can be safe, and
absolutely,
this Christmas for my family is going to be different, and I wouldn't have chosen it, but I don't want to compromise my family members or my community because of an annual holiday.
Just for the sake of a couple of days. I mean, did you have the saying in Canada, don't fall at the last hurdle?
Yeah,
we have that one. Yeah. Right. So in the United States, there's going to be a big increase in cases, 2 weeks, 3 weeks time hospitalizations, 4 weeks time deaths. It's baked in now because of the behavior. And I completely share your concern over Christmas. In the UK, Christmas could mean that hospitals are overwhelmed in February. That is quite possible. And the government seems to basically have said, do what you want, really. And it's, we really do need leadership. So certainly, I'm sure you and me would agree with the message that, as you say, this is a one-off Christmas. It has to be different.
Yes.
Just for a short period of time, grandparents and grandchildren can't hug and do things they would normally do, but it's going to get better. Sorry, go.
No, I was just going to say, we're so close. The vaccines are coming. I just I don't want to see people throw this away at the end here. I mean, we're not at the end, but at this point, we've come this far. Let's just put our just hold on a little longer.
Absolutely. Yeah. Lindsey, that is a great insight into Canada. It's confirmed a lot of the things I thought, a couple of things I hadn't thought of, and I must say it has confirmed some anxieties about Canada, that things are going in the wrong direction. And even though the numbers look small compared to the UK or the US, we always have to look at this in terms of the ratio between poorly people and hospital capacity.
That's right.
And and that is going to be a potential problem in Canada. And basically, I think we're both a bit concerned about it. We have to wait and see. But it sounds like things could be getting worse in the next 3 months until the vaccines really start to give us some benefit. So I think we will both appeal to the people of Canada to do all the basic things, not to take this for granted. Take this virus seriously. Another 3 or 4 months, and next spring things are going to be a lot better. Just hang tough until then is the message, I think. Would you like to give any other messages to your countrymen that are still watching? I'm sure there's quite a few.
Yeah, no, I would just say, hang in there. There will be an end to this pandemic. Don't just throw your hat up and just give up. There will be an end, and it's hard on all of us. Pandemic fatigue is something that we are all feeling, but don't allow that to to crowd your judgment. It'll be a different Christmas. It's going to be a COVID Christmas, but it can be a safe Christmas, and it'll be okay. It'll be okay, and we can all come out on the other end of this.
Absolutely. Lindsey, fantastic. Thank you very much for that.
Thank you, John.
We're hoping to bully Lindsey into doing another video talking about some of the professional issues that she's been researching lately as well. But we'll see how she feels. So, but
Sure.
if you got to the end of this, thank you for watching. And
Yes.
if you're in Canada, special thanks, and
Thank you.
let's hope things go well.
Thank you,
Thanks.
John.
Thanks.
Bye-bye.